Welcome back to Doc Talk. I'm here with Gillian Marsollier talking about acupuncture and all the many things it can offer, traditional Chinese medicine as well. Before the break we were talking about, we could go on for hours, I'm sure, about all the things you can help. It's like asking, a Western physician, well, what can you help with? But maybe something specific, women's health, menopausal symptoms, that sort of thing. Is that something that, people may not think of that? How can, putting some needles in the body help with that? But it can, is that right?
It absolutely can. Well, menopause is not, it's kind of a newer, not a disease, but a newer symptom set, really. It didn't exist so much before, and it doesn't exist very much in Japan and China either. Everyone knows of those studies. But the way we treat it, again, we look for the imbalances in the body, and our theories behind why so many women have it now is we have an energy that we have the yin and yang energies. One is kind of cold, one is hot, and there's other relations to it also. But when a person ages, they lose their yin energy, and that's normal. But when a woman works too hard, burns the candle at both ends, does drugs, alcohol, has a poor diet, busy, stress, all these things deplete the yin. The yin being a cooler energy, it grounds the yang energy. So if the yin is very low and it's depleting anyways as a woman ages, when they go through menopause, that depletes even more and the yang energy flies upwards. And so you get all these hot symptoms, the tropical moments that the women get. And that's actually an energy that's not being grounded by another energy. The two have to work together. So using the needles, we can actually help to ground that yang energy down and nourish the yin to keep the woman's skin and fluids wet, really, to keep them feeling good so they don't feel crazy at that time, to take the anxiety down, and to just rebalance the system in general. It's actually one of the best treatments for menopause.
That's interesting. Now, you mentioned that there are significant differences in the East in these symptoms. From your experience, your training, why do you think that is?
I think their diet is a lot better. It's a lot more natural. Now, not as much anymore because for some reason they're kind of going more Western and we're going more Eastern, it seems like the trend. But their diet's cleaner. The food they eat is cleaner, a lot more vegetables. I personally think that's the main reason behind it. Our diet is not so good anymore, and that really depletes a lot of the nutrients in our body. And so we become more imbalanced, and you really start to notice it at life change times. So a woman will really notice it at menopause.
It's a time when the body has some stresses on it anyway, and it'll maybe magnify what's coming out.
That's exactly it. That's exactly it, yeah.
Okay, well, we could talk about lots of things, and we'll come back if we have some more time, but maybe you could see what you can do about fixing my leg here.
Sure.
Help the pain and see what you think.
Okay.
So I'm gonna, you said the opposite leg, right?
Yes.
Haven't shaved this week, so you'll have to forgive me. So.
For a couple of years, looks like.
So just so everyone knows, about 3 weeks ago I broke my leg, the tibia down low and the fibula up high here. So I've been walking around in this ski boot for 3 weeks, and it's getting better, but it still hurts quite a bit and it still swells quite a bit. So Gillian's going to see what she can do for me here. Maybe you can just tell us what you're thinking about and what you're doing.
Well, it's a little limited of where I can actually reach to. Normally I'd have your shoe right off, but that's okay, take it off.
Let's make it happen.
Good. Hope those are clean.
Absolutely.
Basically, like I said, the meridians run on both sides of the body, so if you're getting what we call a qi and blood stagnation on the one side, which is another word for pain in Chinese medicine, then I can use the other side of the body to stimulate that side. So I can use points that are within the local area and also one to pull away from the area. So if you broke it there, I need to put an acupuncture point right here. I need to put one also away from the area to pull the energy away. So that's all. I'm going to put in 4 points.
Okay. I'll be able to play rugby next weekend, right?
Not quite.
We'll see what happens.
So we now have to use guide tubes, actually, in Canada, with our needles. The needles are only about 3 hairs thick. About 4 or 5 of them can usually fit through a hypodermic needle. They're so tiny.
Wow.
Yep.
Guide hair for safety and cleanliness, is that the idea?
Yeah. Yep, that's exactly it.
Didn't even feel it, just so everyone knows. I'm not trying to be tough here, but didn't feel a thing.
It's not a painful procedure. There's different methods. The Chinese method is a lot deeper. And there's many theories on that, but the Japanese method for acupuncture is really, really light. They practically lay the needles right on top of the person. So I'm just doing a lighter technique. I prefer that. Western patients do not like deep needling. They don't like pain. Now, a treatment can be very painful if someone wants to go very deep, but there's no point in doing that.
Yeah, but I'm not feeling that even at all. I mean, not that it's not painful. I'm not even, which is neat. I've had some acupuncture on my Achilles tendons, which I must say was a little uncomfortable, but it helped.
Some treatments are really, really strong. If you're going into a painful area, it's going to hurt.
Right.
Not a lot, just a quick little pinch, and that's all there is to it. When you're not going to a painful area, you may not feel very much.
So you said you're going to go down from and across from, is that the idea?
Yeah, or at least one away. It could be up or down. Yeah.
Okay.
And one more needle for the other side here. Just, oops.
So in terms of for an injury like this, it's 3 weeks old, how many times should one have a treatment?
And that's a really good question. That's really hard to say. Depends on the person. If you have very poor circulation, you're going to be coming a lot more than someone with really good circulation. You seem like you have good circulation. I would say 4 to 5 treatments till you're really starting to feel a lot. You could feel some from one treatment sometimes, just a little bit of loosening the other side. You know, healing starts going a bit faster, stuff like that.
Circulation's been interesting, though. I mean, one of the things that I obviously expected it, but the discoloration and the purple color even now, 3 weeks later, is pretty stunning. So
oh yeah,
we'll see if it makes a difference.
There's some herbal liniments you can put on there too, and it helps. It soaks right in to move all that, and the bruise just comes right up and out, and it's crazy.
Well, it's interesting. I was going to mention to you off air. I mentioned to you I was in Belize a few weeks ago, and we were doing some filming about our work, and we went to see a traditional Garifuna healer. And that's what she did for me. She put on some liniments.
Okay.
And the color of my foot went from purple to almost normal in a matter of several hours.
It's amazing,
Yeah,
some of the stuff
really
out
was.
there. Yeah.
It was cool. Okay, well so I'll leave those in for a bit?
So usually you leave them for 20 minutes, so we'll just leave that till the end if you can.
Why not? Okay. Why don't you tell me a little bit about